Our first presenter is Phyllis.
Thank you very much. I'm Phyllis Johnson. In 2011, I got a text message from my son, Dane Johnson, and it said, "Mom, I can't do this anymore. I need help." I took a one-way flight, and that was the beginning of years of trial and error using conventional medicine, alternative medicine, to eradicate and hopefully reverse Crohn's disease for my son so he could live a quality of life. We were successful. He has gone on to help others. He's fully in remission with the use of no drugs. He helps others. What did I learn from those experiences? Number one, I learned that if I didn't have cash, my son may not be with me today. And number two, I also learned that I'm not the only one in the United States that wants options for integrative health care. I love my conventional medicine, but I realized that to eradicate Crohn's and give him a quality life, I needed more than that. I'm Phyllis Johnson, the founder of eFundYourHealth, and eFundYourHealth is a solution to that problem that we experienced. We are a social funding platform that supports anyone of any demographic income to get access to the options of alternative medicine, a term used by NIH called complementary and alternative medicine. So what is the problem out there? How is it that the demand is so high? 87 million Americans are sick with one or more chronic diseases according to the NIH. In addition to that, according to the NIH, 20 million of those Americans now want options. They are now buying products and services that are largely uninsurable. What's amazing about that is the problems in that alternative medical industry. Like I said, it's cash-based. Most of it is uninsurable services and products, that they're still buying it. Number two, data outcomes. How on earth is an insurance company going to be able to adopt these natural options that they would like to do without any data outcomes in the medical pathway that can easily be adopted into our system? With all these problems, we still have 187,000 practitioners in the United States that are servicing these chronically ill, and it's getting larger. It's one of the largest industries in the United States growing right now. So I put together an amazing team that brought all kinds of skill sets. Jeff Ulinet is the former COO of United Healthcare Dental. He's the one that built my business plan with me. He gave us our legal structures to enable the whole wellness community to come together and help those who don't have access to options. My board and investors are very active. Victoria Stevens is in the room right now, former United Healthcare as well. I've got very active board members from the insurance industries, the conventional medical industries, and the alternative medical industries. Together, we build a solution that I call the Alternative Medical GoFundMe. Now, it's bigger, and it's a bigger, better box, and here's the reason why. Because we use the whole wellness industry to ensure that those patients raise enough money to get the funding they need, to get the options they need to get well. How do we do it? Practitioner-referred solution. We are a B2B model. Practitioners refer them into the site. I have 187,000 sales forces out there right now. They refer them into the site. They do the usual GoFundMe, friends and family. They raise their money. Then I have corporate donors that donate to our unique corporate structure. Jeff and I structured this originally. That enables corporate donors to provide tax-exempt donations, which grants us the ability to go right to the patients. There's the next part of the wellness community, making it happen for the patient. The third group, I call them stranger donors. These are the people that don't donate to folks they don't know. And why would they? You don't know what they're going to do with the money, right? We provide a debit card that restricts the use of funds to medical. It's a debit card that's used by the patients and enables stranger donors in. Cancer survivors, Crohn's survivors, people passionate about the wellness industry. Every one of my campaigns is seeing these kind of donors, and I love it. And why do we do this? This makes me get up every day. Since 2014, I've been doing this. This makes me get up every day to do it. The patients are seeing the results. So where are we right now? I did this for years, but we brought in the first round of funding for $150,000. And what's exciting about this is we opened up one event in New York City, and from one event, our patients did their first donation in June. We built the legal structure, protected the corporate donors, patients, practitioners from legal restrictions and lawsuits. In June, the first donor came in. The patients raised $50,000. The practitioners came in and referred them. We raised $68,000. We raised more than the patients did from the corporate donors. And here's what's exciting. They brought in 1,000 registered users in 4 months. Those users are now going to be able to experience all kinds of wellness solutions that we are now bringing in with new affiliates that can further help our patients. So it's going beyond the need for funding. So how do we make money? 13,000 campaigns, we break even. Remember, 20 million people are chronically ill, they want alternative medicine. 25,000, we get net at the bottom line, 1 million. We need $200,000, and that's going to take us and expand us nationwide. And that's going to enable us to launch eFundYourHealth to achieve those campaigns. The future is the database. We are collecting data from medical patients by disease and the use of their funds. But more importantly, this is a portal. We already have 3 affiliates that want to reach out to these patients and bring more to them than just funding. So what are we? We are answering demand for an integrative approach to medicine without fighting Congress. So let's get healthy.